All right, my name is Greg. This is the critical assignment presentation for KIN562, Exercise and Fitness Education. My client originally completed a health assessment, the PARQ. The PARQ assesses the presence or the absence of cardiovascular, pulmonary, and metabolic disease risk factors, usually before any physical activity is initiated. So my client reported a clean health history record, no major signs or symptoms of disease marked, and marked only one cardiovascular risk disease. And that was having a BMI of 30 or more. But she did not mark that she was pre-diabetic. And this is important because it would have increased her risk level from a low to moderate. So according to the ACSM handbook and the PRQ, my client is considered low risk or asymptomatic and is not required to complete a medical exam before starting physical activity. My client also completed a movement assessment on the FMS, the functional movement screen, which is comprised of 7 individual compound movement tests that evaluates movement efficiency. My client scored an 11 on the FMS, whereas the general population, the mean FMS score is usually 13 to 15. And this indicates that my client is at possible health risks associated with various levels of exercise and training. But this does not mean in any way that she is unable to proceed with a modified exercise program. And then to break down her FMS results, I listed out the 7 exercises as well as what I scored them based on her videos. 1 being the lower end, 0 being there was pain experience or which she wasn't able to do it at all, and 3 being that it was perfect according to the FMS. And so just overall takeaway from this is that movements that targeted the hip, torso, knee, and ankle showed major deficiencies in mobility and stability. So the focus of her program is going to be compound movements that target her specific weakness or weaknesses and that are associated to the least amount of risk of injury when performed correctly. Based off of my client's health and movement assessment, we identified that her primary fitness goal is going to be improving body composition, primarily focusing on increasing lean muscle mass and lowering her body fat percentage. This would significantly increase her mobility and flexibility, decrease her injury risk, and decrease her risk of specific diseases associated with obesity, overall enhancing her quality of life. Hunter 2013 identified that the best way to do this to increase body composition is by adding not just resistance training, but also aerobic training as well. So we're going to look at specifically at the resistance training portion of her training program, and we're going to focus on compound movements that specifically target her weaknesses and that are associated with the least amount of injury risk when performed correctly. Paoli noted that a training program comprised of multi-joint exercises, compound exercises provides better adaptations to general fitness and body comp than single joint exercises alone. So when we're looking at exercise selection, we're going to be using a lot of compound, more the simpler compound exercises such as the bench press, the bent over row, shoulder press, bicep curl, tricep extension. On the upper body day, the lower body day is going to be comprised of a back squat, deadlift, reverse lunge, just a standing calf raise, some step ups, and then on both days we're going to hit the core with some abdominal sit-ups. Talking about exercise order, half and triplet, I found that lower body and upper body exercises that alternate movements based on opposing or dissimilar muscle groups prevents muscle fatigue and improves recovery and recruitment between exercises. So for her upper body day, we're going to try and break it apart. We're going to try and alternate between push and pull exercises. And then lower body day, we're just push and pull exercises aren't very simple to kind of point out. So we're gonna look at the exercises and kind of prevent similar muscle groups from being worked in a repetitive order. All right, so speaking directly on the frequency of our client's training, half and triplet identified the most ideal amount of resistance training for a deconditioned and beginning athlete, which are client is 2 to 3 times per week for resistance training. A 3-day per week frequency is going to be implemented. We're going to focus on resistance training Monday, Wednesday, and Friday. And basically we're going to look at it as like a 2-week block because we want to target the upper body and the lower body muscles the same amount. So the way we can do that is we can look at it as like a 2-week block. So in week 1, it would be Monday's upper body workout, Wednesday's lower body workout, Friday is upper body workout again. And then on week 2, it's just the opposite of that. So we're hitting the upper body 3 times and we're hitting the lower body 3 times in a 2-week span. For our client's intensity, we're gonna stick to a hypertrophy training goal because it will increase her lean muscle mass and decrease her body fat percentage the most, which kind of sticks to her primary training goal. So my client's training intensity goal, based off of what Half and Triplet recommended for an ideal hypertrophy training goal, is going to be 6 exercises for each training day, 3 sets of 10 repetitions per exercise, rest recovery time of 60 seconds in between each set and each exercise, and the starting load at the beginning of her program is going to be 67 to 70% of her 1 rep max. Looking directly at the duration of each training is going to relate directly to intensity. So to complete the 6 exercises, to complete 3 sets of 10 repetitions of each exercise, it's going to take about 40 to 45 minutes, and that's without the warm-up or the cool-down. And then for the periodization model or approach that I focused on with my client's program, I chose the linear model because it seemed the most simplified, and it seemed that it's not going to overcomplicate things for my client because the intensity progresses at a linear rate, and the number of sets and repetitions of each exercise remains the same throughout the entire program. So the linear model focuses on progressive decreases in training load over training days, as we see in the week 1 and week 2, and then gradual increases of intensity from one mesocycle to the next. And we're actually going to extend the mesocycle from 1 week to 2 weeks because we want to complete multiple training days for both upper body and lower body before we move on. So week 1 and week 2, this is the same for both upper body and lower body. Exercises performed at 70% 1 rep max on day 1. Exercises performed at 67% 1 rep max for day 2. Week 3, week 4, they go up by 3% increase. And then by week 7, week 8, exercise performed at 78% 1 rep max on day 1. Exercise performed at 75% 1 rep max by day 2. As for our client's aerobic training, the exercise selection, we discussed it and we agreed that cycling or fast walking would be appropriate to start with. A lot of the research that I did either had their clients cycling or jogging, and I think jogging might be a little bit too much for my client initially just because she is so deconditioned. So cycling probably would be the ideal exercise method for aerobic training. As far as frequency, we already identified that 2 times a week is ideal, with about 2 to 3 times a week of resistance training for decreasing overall fat percentage and increasing lean muscle mass. Hunter 2013 identified that the optimal intensity of aerobic exercise targeting decreasing fat mass should fall between 50 and 70% VO2 max, and that the ideal duration is over 30 minutes. So looking directly at the bottom right, my client's training program, it's going to follow very similarly to Hunter's, which is going to be 2 sessions per week, starting at 25 minutes of exercise at 67% max heart rate, which is equal to 50% VO2 max, with intensity progressing from week 2 through the end of training. Looking specifically at progression, additional time will be added in weeks 2 through 4 until the total time is at 40. So in week 1, it's starting at 25 minutes. Week 2 is going to be 30 minutes, so on until it reaches 40. the second half of the training, so weeks 5 through week 8, we're going to be increasing max heart rate by 3 to 4% every week until the heart rate is about 80% max, and my client's VO2 max is 70% or above the entire duration of the aerobic exercise. For the last exercise technique video that I made with my client, and the URL is right down there at the bottom, we looked at 2 exercises, one lower extremity, the step up, one upper extremity, the bench press. With both of these, my client really struggled with the eccentric movement, specifically talking about the step up. She was allowing gravity to kind of just allow her to pull her down instead of controlling the movement. And what this does is it takes out the entire eccentric portion of the movement that really contributes to hypertrophy and strength. And then as far as the bench press, it was all talking about her angle of the humerus. So as she lowers the bar, or on the eccentric movement of the bench press, I was really trying to coach her to tuck the humerus into the sides. And what this does is it sets up proper alignment for the shoulder joint and allows her to properly lower the bar and then push it back up to the lockout position. And you'll see it there in the video. And so looking at the application of what we learned from this class, I want to teach probably lower than college, and then eventually work my way into college and work also alongside coaching the general population. I've been working as a fitness trainer for some time now. And so this class really played into challenging me in what I currently know and challenged me to learn a little bit more about myself as a coach and about how I can better help and address all of my clients' needs. And it made me a better coach. It made me a better teacher. And then as far as opportunities, I think this is all tied in. The biggest struggle for me was teaching movement and using coaching cues to teach movement, because I know how to do the movement and I know what it's supposed to look like, but it's really hard sometimes to direct someone else, especially when they've never seen the movement or they've never watched videos like you have on the movement, to coach them and to do the right thing. So working on my abilities to communicate information and deliver it in a way that is easily understood by others, I think is my biggest teaching opportunity or learning opportunity from this overall class. And that's something that I can take moving forward into my career. And so for the faith integration portion, I just have 3 verses that I think kind of all go together. The first 2 especially. So Timothy 4:8, for physical training is of some value, but godliness has value for all things, holding promise for both the present life and the life to come. And then Isaiah 40:29, which really correlates with the last one. He gives strength to the weary and increases the power of the weak. I think these both have to do with something very similar. And so it's really that idea that it's not the physical aspect that makes us powerful. It's not training every single day to do something that makes us powerful. It's the faith aspect. It's the spiritual aspect. It's not just our life here that we focus on and that we train for. It's our life to come, and that is our life with God. And then the last verse, Ephesians 2:10, for we are God's handiwork, created in Christ Jesus to do good works, which God prepared in advance for us to do. I think this speaks directly to us as teachers, as coaches, as fitness professionals, and the way we treat our clients. And so how would we demonstrate Christ-likeness with clients? And I think that is relating to the top 2 verses, and that is we incorporate this concept of faith in God, and we incorporate this concept of spirit, and that this isn't, we're not just here for the physical training. We're also here for the spiritual training, for the faith training, that it's all related and you can't have one without the other. And if you do, it doesn't make you whole. It doesn't make you completely powerful. And I think that these 3 verses really kind of tied into everything we did with this entire class, and specifically this portion and this assignment. And that's about it.